Hi, this is Dr. Russell with Serenity Natural Health Center, and today we're going to talk about polycystic ovarian syndrome, otherwise known as PCOS. So, as far as the disease itself goes, the cause is still unknown. There are many theories that have been discussed that may contribute to it. So, without getting too much into the science, we'll just briefly go over a few of them. So, it may be due to increased production of androgens and estrogens in women. It may also be due to increased insulin levels, which we know of insulin with diabetes, or it may be due to estrogen dominance or unopposed estrogen, meaning the estrogen and progesterone levels are not balanced. So, in summary, there's not one mechanism that really explains what's going on with PCOS, and it may be one or all of these in some kind of collaboration. So, as you can see from the diagram, we have the pancreas on the left, which secretes insulin, and in PCOS, with insulin resistance, we have increased amounts of insulin being secreted, which promotes more androgen production, which in turn affects the liver and increases insulin resistance in the peripheral tissue. So, why do we care about PCOS? Well, PCOS is the number one cause of infertility in women. It also contributes to menstrual irregularities or dysfunctional uterine bleeding. It can cause hirsutism, which is hair growing in places that you don't want it to, like your face or your back or your chest. And more concerning is it may cause endometrial cancer. It also can cause cardiovascular disease and diabetes, as well as contribute to having a decreased or reduced quality of life due to things like poor self-esteem and depression due to this health condition. So some of the signs and symptoms that doctors typically look for, again, hirsutism, so abnormal hair growth, acne, alopecia, which is hair loss, again, the menstrual irregularities, acanthosis nigricans, which is a darkening of the skin and the skin folds, obesity, mood disorders, abortions that happen again and again, as well as even some lab evidence. So on ultrasound, we might find the polycystic ovaries, or you might have increased cholesterol, triglycerides, LDL with lower HDL. There are diagnostic criteria for PCOS. However, some women, since it's a complex disease, may not fit all of these diagnostic criteria and go undiagnosed. So as far as naturopathic approaches go to helping with this disease, we'll start with the conventional treatment. So conventionally, they recommend weight loss. However, not every woman that has PCOS needs to lose weight. I believe about 80% of women with PCOS are overweight, but that leaves 20% that weight loss is not a factor for them. Women are put on metformin for the insulin resistance and diabetes. Clomiphene citrate, which is a drug they use for infertility. It basically helps stimulate the ovaries. And then spironolactone, which is going to help with the increased androgens and try to decrease the effects of that. And then just oral contraceptives or general birth control. However, with any drug, there's always going to be side effects which are concerning, and then we're not really treating what the cause is. We're just kind of masking symptoms. So naturopathically, we can approach with lifestyle nutrition. We recommend insulin-resistant diet since there does seem to be an insulin resistance piece to this disease, as well as some certain foods that have been shown to help with the insulin resistance. And then if it needs to happen, we can recommend weight loss if the woman does need to lose a little bit of weight. So as you can see here, we have normal insulin functioning on the left, and on the right in PCOS, you can see there is a change in the phosphorylation pathway, and it basically promotes more androgens being formed. There are supplements we recommend. Obviously, you want to see your naturopathic doctor in terms of dosing, but certain things they might recommend is inositol, pentothal. If vitamin D is deficient, they might recommend supplementing with that. Chromium, N-acetylcysteine, which is NAC, or even berberines. There are many botanicals that help with what is going on with PCOS, so green tea, nettles, saw palmetto, tribulus might be a few of those. And then for Chinese medicine and acupuncture, there are many points and meridians. This might not make any sense to you, but things that we can recommend for acupuncture that can help. And then there's other considerations. So there might possibly be hypothyroidism contributing to the condition, some possible environmental toxicities that need to be tested for. Homeopathy is always great for conditions like this, as well as stress management. So again, there are many naturopathic approaches we can take for PCOS, and always consult your naturopathic doctor for recommendations.